Hello everyone, welcome back for another edition of Virtual Yin Yoga. I'm your instructor Mike, and I'm happy to have you with me this evening. What I wanted to do for tonight's practice is another hip series, playing around with some variations here and there. And when we're talking about the hips, we're really referring to the hip flexors, IT bands, the adductor muscles, and with that our hamstrings tie into it, but not as much as they do our spine, but we'll still work that a little bit. And we'll probably do a twist here and there. So gather up any props that you might need. You may need a yoga block, those are excellent props, or if you don't have that, pillows are great too. A blanket, towel, if you have a yoga strap, those are great as well. Obviously if you have your yoga mat, roll that out. And once you got those props, go ahead and let's get started. And we will begin our practice with our eyes closed. Laying down on your mat or sitting upright like you're in meditation, just wherever you're comfortable right now, just go there. And when you're there, you'll close the eyes. And I want you to start paying attention to your breath by breathing low in your belly, low in your diaphragm. And if you'd like to double check if you're doing this correctly, place a hand on your stomach below your belly button. You're gonna feel the stomach expand. When you take an inhale, it contracts when you take an exhale. And this is belly breathing. It's a breathing technique that I recommend for our practice. It's a slower paced practice, and belly breathing will slow the body down. It's exactly what we want out of that. What we're doing is Yin Yoga, a gentle, passive style of yoga where you hold slow, static postures for an extended period of time to stretch the body. And we're talking about the connective tissues, not just the muscles, these deeper tissues that really hold the muscles, the bones, and our organs together. How we do it is by holding poses for a while. With our practice tonight, we'll probably do these poses roughly 2 to 3, maybe even 4 minutes. We'll see how it goes as we go along. But so we all know, times are arbitrary and subjective. So if your better judgment is telling you to come out of something early, please know that that is fine, right? You don't have to hold the pose the entire time. However, if you feel comfortable and you want to hold it the entire time, or possibly even a little longer, it's up to you. But my advice to you is to just let experience be your guide. Let your body tell you what you need to do. Go ahead and take a few deep breaths, and when you're ready, you can open your eyes. And we're going to start our practice off loosening up hips and spine as we always do. I want you to just lay on your back. Bring your knees up to the chest. You're going to just cradle legs, right? Rock up and down on your spine. Go side to side as well. If you crack your back, go for it. Make circles while you're here too. All right, this is just your opportunity to loosen some things up. Nothing too strenuous. Right now I'm actually filming this at like 8:30 in the morning, so this is really more of a wake-up practice for me. Which, by the way, any of these practices that we do, you don't have to do them at night. A lot of times you're going to find out that it's actually better to do this kind of thing in the morning, just because you're so stiff and you're so tight, and you need something to alleviate that to help you through the day. So if you feel like you want to save this one for your morning practice, by all means go for it. We're going to start this off with our IT bands. And the IT band is the outside of the leg. It runs from hip to knee. Iliotibial band is why they call it that, because it runs from ilium to tibia. But it should be a broad stretch on the outside of your legs, whatever one you're going to do. But if you start feeling knee pain or hip pain, just listen up to those modifications that I suggest, because we can work around that, right? I don't want you to push through knee or hip pain. It's anything that feels like you're stretching directly in a joint is overstretching. So not just in the knee or hip, it could be anywhere. So please keep that in mind. What I wanted to do is a Swan Pose today. Swan Pose is a great one for the IT bands, but as well as a little bit of tilt in the pelvis, just a little bit of flexion. So what you're gonna do here, you'll have one leg in front, you'll have one leg behind. It will be your front leg getting the stretch. I'm only setting up this way because it's easier to talk to the camera. So for me, right now, I have my left leg in front, I have my right leg behind. There's lots of ways to modify this. One is to have your shin basically parallel to the top of the mat. You don't have to do that though. You might actually find out it's safer for your knee to bend your knee and bring your foot close to the groin. I would just say whatever is going to protect this, that is what I want you to do. So play around with that. Lean forward, hands, elbows, head on the block or head on the floor, pillows if you got them there too. If you can't get all the way down, feel free to use one of those props. Your back leg can be adjusted as well. A lot of people want to have that back leg straight behind them. Usually you'll see people, when they hear pigeon pose, that's how they're going to do it. They're going to have that back leg straight. But because we're doing yin, we don't really care about alignment, so you could possibly even bring this back leg kind of around you and to the side. And when this leg starts to come around to the side, you start to have a little bit more external rotation with your pelvis. For a lot of people, it's going to make it more comfortable because it can bring that front hip down on the ground. Sometimes that hip is going to be up high in the air, and that's really uncomfortable. So feel free to modify that by bringing this leg around it to the side. And actually, I think I'll do that today too. What I like to do, I call it the sleeping swan pose, where I'll actually rest my shoulder on the inside of my knee. So again, just for reference here, I have my left shoulder coming down to rest on the inside of my left knee. And now I'm feeling my IT band while I'm here. But instead of a direct forward bend here, it's actually more of what's called lateral movement or lateral flexion, because we're bending forward but also going to a side. So it's up to you. It's not really working today. Sometimes you try it out, it's not really feeling it as much. So if that's you, don't waste your time forcing a pose. It's something I want to remind you all the time. If it doesn't work, it doesn't work. And that's okay, right? We just want to find something that does. But typically out of the options and modifications I gave you with this pose, you're going to find something that works for you. Remember to breathe while you're here. Some deep inhales, deep exhales. Really let muscles soften while you're here. Go ahead and take a few deep breaths, and when you're ready, there's your time. Really slowly, I want you to make your way out. Maybe you just want to lay on your side or on your back for a moment. Either way is fine. Just find a comfortable place to relax, and in a moment, we'll get the other side. Other side when you're ready, whatever side you happen to be on, just make sure it's the other one. And remember, with the swan pose, it's going to be your front leg getting this one. So now, again, for reference, I have my right leg in front, I have my left leg behind. So I'm going to be stretching my right leg's IT band, the outside of this leg. A lot of ways to modify it. Maybe you want to have that shin parallel top of the mat, or maybe you just want to bend your knee to bring your foot in close to the groins. Whatever is going to protect this knee is what you need to do. Leaning forward, hands, elbows, head on the block, pillow, head to the floor if you can get there, but if not, don't worry about it. Your back leg, it could be perfectly straight behind you, like so, or you could always modify it by bringing your back leg around you to the side. And again, this is just more of a rotation of the pelvis. When this back leg comes around, it turns the front hip out. And this is to make sure, well, you don't have to do this, but it might be comfortable to make sure that your hip is actually on the floor. Because a lot of times, for most people, when they do a swan pose with the back leg straight, their front hip is going to come up off the floor. And if that's really uncomfortable, then let's not push through that, right? Because it's not really therapeutic to do that. The therapeutic pain that we look for is broad stretching that you should be able to feel on the outside of your leg. If you can just wave your hand and be like, yeah, whole thing is getting stretched, then you're good to go, right? That's exactly what we want from this. Which, by the way, I talk about it a lot, but so we all know, that is called tension. Tension is a broad stretch that you can wave your hands to, say, yeah, the whole thing is feeling it. That is therapeutic because that's what you can change, right? You just keep stretching, you become more flexible. So you got to give it time, right, to work through all of that. And it could take time. It could take months. It could take years to get there, but you'll get there as long as you keep practicing. Go ahead and take a few deep breaths, and when you are ready, there's your time. Again, slowly letting yourself out to lay down. Right? Take that moment to yourself. Short breather, and then we'll start working into our hip flexors and our quads a little bit. The next target area that we're going to work into is going to be our upper thighs, quads, right? These really, really big muscles right here at the top, upper thighs of the leg. So what you're going to do for this, I was going to suggest dragon pose. And a dragon pose is more of a lunge. This is actually technically more of the knee-friendly options. The only thing that you might have to worry about with the knee is bone on floor pain. And you can always alleviate that by using more cushion. So you may want to take your mat, fold it over, or put a pillow under the knee, and I'll show you how to do it. So again, just for reference here, I'm going to be stretching my left leg's, quad. So what you'll do, I'm going to have my right leg in front, I'm going to have my left leg behind, right? Whatever leg is behind you, this one right here, that's going to get the quad stretch. So you're going to feel a broad stretch there. And you can always modify it by having both hands down on the floor. If this is a lot of pressure for your upper body, you could always rest your chest onto your knee like so. Again, this is just going to help you keep yourself upright here. But some people like the challenge, both hands down here. I like to turn into my front leg as well. So if let's just say again, just for reference, my right leg is in front of me. So what I'm going to do is turn my right here a little bit. There it is, right? It's like an immediate shift in the pelvis is what greatly increases the stretch. So don't be afraid to modify and try different things out, because it's one of those things you're just never going to know if it works for you unless you try it for yourself. Be here probably for another minute. This one, it can be one of the more challenging postures. Again, just holding yourself up like so could be a little difficult. But this is also a great way to start building up body strength. In Yin Yoga, you're basically going to do no strengthening. So this is like your one option that you can always do here. Every now and then somebody will ask me to strengthen in Yin, and I just kind of like, you're in the wrong class, buddy. I wish I could help you, but Yin is stretching, really. Yin is meant to be passive and gentle. It's not meant to be active. If you want to be active, you need to go to an active class. Strengthening styles of yoga, Ashtanga, Vinyasa, Hatha, anything that involves moving is going to strengthen you. This is about less movement though. Not a bad thing, just different. When you are ready, there's the time for you. Real slow, you're going to make your way on out of this. I like to call it the runner stretch. We have this one leg, your front leg, straightened out a little bit, and then you kind of work yourself into a child's pose. And we'll take a minute off here just to relax. Other side, when you're ready, whatever side you're on, just make sure it's the other one. But for me, now, I have my left leg in front, I have my right leg behind, and we have to remember our back leg, this is the one that's going to get stretched, be right here through the front of that back leg. I did mention bone on floor pain is not therapeutic, so you may need some extra cushion. Feel free to take your mat, fold it over, put it under that knee, or take a pillow, blanket, something like that, that just gives you a little bit of cushion. You can always position your hands with both hands down the floor in front of you, or you can have one on the inside, one on the outside, so you can rest your chest onto your shoulder. I would definitely recommend it if it starts becoming a lot of effort to hold yourself up here. You know, we don't want to struggle and strain too much here. Now we do want to, you know, we want to challenge ourselves, but not to the extent where we're so uncomfortable that we can't do the pose. Right? We look for what's called a comfortable discomfort, which is just a nice way of saying, yeah, it kind of hurts, but I can deal with it. Right? It's therapeutic. Remember to breathe while you're here. And if you want to try the modification of turning into your front leg, go for it. Again, for reference, my left leg is in front, so I'm turning left a little bit, and that's what's opening up that quad and hip flexor. Just breathe while you're here. Give to the stretch. I know that can be tough, but you know, it's one of the goals of our yoga practice, not just in yin, but in all forms of yoga. It's about giving in to the posture. And we can do that. You know, we can do that. The more we do this, the easier it is. Go ahead and take a few deep breaths when you're ready. Each time, just real slow, let yourself out. Probably into a child's pose. With a minute off. The next target area that we're going to focus on will be our inner thighs, the abductor muscles. Abductors, again, inner thighs, there's a couple of ways to do it. I am actually going to start giving you forward bending options right now. So if you're saying to yourself, I kind of want to work my back, then listen up, I'll give you two choices. But then I'll also show the hip opener as well. Butterfly is going to be your first option. Soles of the feet brought together in front of you, you've fallen round in the pose as best you can to stretch your inner thighs and your back. Right? We're involving the back now if you want it. Just be mindful of how your knees and how your hips feel. If you start feeling knee pain or hip pain, you're probably going to want to do something else. Usually a dragonfly will be the safer option. You spread out the legs and lean forward. This is called abduction here, right? So you're leaning forward to get these inner thighs, hamstrings as well, and the back. But your hip opener option, if you feel like you do want to just keep working the hips, reclining butterfly is always fair game. It's where you keep the soles of the feet together, you lay on your back, right? You get the inner thigh stretch here, but you don't have to bend forward with it, right? You keep the pelvis and the sacrum level with the floor, which is what makes it kind of more about the hips. So if you feel like, you know what, yeah, I need hips today, well, then go for it. But if you're saying, it's my back that I really need to work, then go for that too. Again, these are just options for you to pick and choose from, because if I can be honest with you, I don't know what you need. You know, I wish I could just look at you and be like, yeah, that's exactly what you need to stretch, but I have no reference of that. But maybe if we ever do classes back in person, again, we can make that happen. You know, for me personally, my back is a little tight, which is why I'm switching over from, instead of just doing a hip series, to involving my back now. And this also will target the hamstrings a little bit, which we're going to do a little bit, but we're most likely going to do a shorter pose for it. Remember to breathe, right? Deep inhales, deep exhales. Allow muscles to soften. I can't emphasize that enough. Muscles have to be soft if we're going to work into our joints and into the connective tissues. It just has to be done that way. So that's why it's okay to not go so far, so that you can make sure your muscles are softening here. Go ahead and take a few deep breaths, and when you are ready, it's your time. You're going to use the hands, slowly make your way out. You can lean back, you can lay down. Take your time there. That's short breather. Like I mentioned, we'll do hamstrings next, but only for a short pose. We're not really focusing so much on hamstrings today, but I just want to make sure that we did a little bit in case you, the viewer, wanted to do some. We're going to work our hamstrings next. And again, just for like a minute or two, nothing too extensive here. But we'll do a caterpillar pose to help save a little time. So we have both legs out in front of you. It will be the back of your legs, right? The back upper half of the legs, it's your hamstrings. You lean forward, you're going to grab something. It could be anything. It could just be the knees, or even your shins, ankles, around the feet or toes if you can get there, but don't worry about it if you can't. This is also where you could use a yoga strap or a towel. If you got it, throw it over your feet to use for leverage to help pull you forward. Just try not to pull back. Right? We're not trying to pull back into this. We want to be able to bend forward into these things. Remember to breathe while you're here. Go ahead and take a few deep breaths, and when you're ready, it's time. Getting a real short one there. Go ahead and lay down. Ease into that. Take our minute here, and then we're going to do a back bend, just to complement forward bends. When you're ready, you're going to flip over onto your stomach. Head for a Sphinx Pose for your back bends. Laying on the stomach, propping up on the forearms and elbows. This is your pose. Not really a stretch or anything like that, but just dull and gentle pressure that we're going to apply with our lower back and the lumbar spine. It's all it really should be, dull and gentle. If you feel sharp right here in your back, lower down. Right, that is always your sign that you're going too far, so you want to decrease that. Do your best to let your stomach muscles soften, right? Your core, your abdomen, let those muscles soften so that we can actually do our back bend here, because if muscles are flexing, it won't allow you to do the back bend. In fact, you start doing this number, you start to like almost hunch in because it's flexing, right? When muscles flex, they contract, they'll bring you forward like that in this example, so, which we don't want, right? We want to relax them so we can go backward into it. This is what you need, right? After forward bends, you need to do a back bend. And honestly, even if you didn't do a forward bend, this is still a good idea for you to make sure that you're maintaining the curve of your lower back, because as we age, that curve loves straightening out from all the sitting that we do. So we want to make sure that the curve stays. We can prevent that. Few deep breaths, and when you're ready, and there's your time, just real slow, let yourself out. Sometimes it just feels nice to lay here. It's going to feel nice at some point, though, to do a gentle forward bend. So like a child's pose might help. One more thing that we're going to do with our practice. We are going to do a twist. This will be the last thing for our hips. It also kind of plays around with the spine too. Reclining twist. You're going to lay on your back, knees up to the chest. Let's all go to the same page. I'm going to twist left here. So you lay on your back, legs to the left. You feel the right side of your back, lower right side, getting the stretch here. Now let's not worry too much about modifications here, right? We just want to relax into our twist. And we'll be here for like a minute and a half, possibly 2 minutes. But you know, in any of these poses, feel free to stay longer. You know, if you feel like you're not getting enough of a stretch, totally fine. You know, I try to make these videos not necessarily short, but I don't want to make them an hour to an hour and a half every single time, because a lot of times people start getting bored during it. But if you are just one of those people where you're saying, I just need all these stretches that I can get, every single one, when we get into a pose, you know, feel free to, you know, to pause the video for a minute or two so you can get a little bit extra on your time. You can always extend this as much as you want, but for teaching purposes, for me, I like to keep these around a half hour. Take a few deep breaths when you're ready. And there's your time, real slow, unwinding. Maybe just lay here for a moment. Sometimes it feels nice to have the knees bent and feet on the floor. You know, this is actually the most neutral position for your spine to be in. Now when you're ready, other side, and if you're on the same page as me, you're going right. So you're gonna lay on your back, knees to chest, legs to the right, lay them on the floor. This is your pose right here, right? It should be a broad side body stretch on the left side of your back here. And again, we didn't really play around with too many modifications because, you know, we're not really focusing too much on that today. We're focusing more on just the rotation of the pelvis, and that's with the twist itself here. So again, for another minute and a half, 2 minutes. Get comfortable. Go ahead and take a few deep breaths. When you're ready, you can slowly unwind from your twist and take your time while you're out here. So again, knees bent, feeling the floor is fine, but you could always bring your knees to the chest like we did in the beginning or throughout the entire practice, or you could just lay flat. You can do whatever you need. Whatever feels best, just do that. We'll take a minute before we get to Shavasana. We are at the end of our practice. And if you're ready for Shavasana, for corpse pose, you can go ahead and lay on your back. But you could always sit upright like you're in meditation. I would say wherever you're most comfortable, go there. And when you're there, close your eyes. There's nothing to see at this point, but just more to feel and pay attention to. Let's start focusing on the breath again. Breathing low in your belly, low in your diaphragm. Turn your senses, your awareness within. And for the last few minutes of the practice, just observe your body. Give it a compare and contrast. How different does it feel right now as opposed to when you first started today? No formal ending to the practice. You can stay in your Shavasana as long as you'd like, but that's officially all that I have for you. I want to thank you for watching and sharing your practice with me. It's been my pleasure. Namaste.